Thank you for choosing Redefine for your hair transplant surgery. So today you already got your surgery done. So I think our doctors might have explained you the post-op protocol and how to use medicines and all these things. Still, I would like to explain again to you in this video format. So you will receive received a kit with the medications, shampoo, and one spray bottle. So I'll explain you how to use the medication. I'll simplify it in next 5 minutes time. You would have been kept a small bandage in the back as a dressing. It's for the donor area, which you will be removing tomorrow. That means tomorrow post-op day you'll be removing it. After that you will have a raw area like a bruise. There you would have given ointment. So this is to apply on the donor area. So you have given 4 to 5 sachets based on the area. So each sachet you can just stir it, take a small quantity like a peanut size or maybe double peanut size. With a washed finger, just thinly apply on the whole area of the donor area. So you can gently apply yourself, you don't need anybody, you can do all by yourself. So this ointment you should continue for next 4 days. So after today, if you got surgery, day 1 is tomorrow, next 4 days you will be using the ointment. By day 5, the healing is done. So this is to take care of the donor area. So second, I think how to take care of the recipient area where you actually got grafts from. You'll be given a bottle with antibiotic solution and some hydrogen peroxide to prevent the crust formation. So this essentially helps us for the first 5 days. So very day, I think since you got it done, surgery done today, so every 2 hours when you're awake, just keep spraying, gently wet the grafted area. So this will keep the grafts moist and reduce the crust formation, so eventually your healing process will be smoother. So you are given 4 kinds of medication. One is antibiotic. So generally to prevent any infection, we generally give antibiotic for 3 days, which is for morning and evening, which you'll be starting one from today. So today evening, since you got surgery done today morning, and next 2.5 days you will be finishing this. Same thing, you have given a small steroid. We generally give steroid to reduce the inflammation and swelling. So this is also short course, only 3 days you need to take this. Again, starting from the same day, today evening, and next 2.5 days you need to finish it. Both need to be taken after food only. So one antibiotic, one steroid. And you have a pain medication which you will be taking 2 times daily. This is also after food. So this you have given 15 tablets because after 5 days, 6th day onwards, for next 5 days or 7 days, we would recommend 1 tablet in the night because you will have a lot of pain in the donor area, which is very common. So for first 2 weeks, getting the unusual pain in the donor area is very normal because you are lying on it. So because of the gravity and because of the sensations, the sensory nerves get exposed. So you have a little pain, which is very usual. So we would recommend at least 1 tablet in the night after 5 days. First 5 days you will take twice, once in the morning, once in the night. These 3 tablets you can take together from the same day of surgery. 1 pain medication, 1 steroid, 1 antibiotic. In addition to that, since we are giving, you are already in stress and you are giving steroids, we are giving antacid, which you to be taken before breakfast. This is only 5 tablets. So which is different from these things, only 5 tablets given. This to be taken tomorrow morning, that is post surgery, first post-op day, empty stomach, every day 1 tablet for 5 days. So this completes your tablets, and I explained you about the sachets for the donor area. Every day you can use 1 sachet because it's quite a big quantity. You can use a little portion, 1 sachet for every day. And the recipient area, which you will be giving hourly 2 times, every 2 hourly 1 time, 4 or 5 sprays liberally you can use it. Even if you put excess, there's no harm. So this is only for prevention. If at all, if you're going out or if you're sleeping, if you miss it, it's okay. It's not compulsion, but if you're at home, if you're at rest, if you can use it, this recipient saline spray with the antibiotic will definitely help you in healing. And your first shower is on the day 5. So first 4 days you can take a regular shower, and your shower will be on the 5th day, because the surgery day is 0 day. First day is the first day. 5th day 5 you can start taking shower. So this is a special shampoo which is given, which is very, very mild and very safe. So this shampoo you will be using, taking a small portion and apply it gently to the scalps. By 5th day the grafts would have already got some strength, so you really don't need to worry. You can actually start wearing t-shirts also from day 5, because first 4 days we recommend not to wear t-shirts. From day 5 you can start wearing t-shirts, and this shampoo with the 2 mugs of water, 2 or 3 mugs of water, gently cleanse it. Use mild pressure. By day 10, you'll be able to clear the most of the crust formation. So pressure can be gradually increased from day 5. From first 2 washes, you can be gentle. From 6th day, you can be a little harder. Donor area, first day, once you remove dressing in the day 1, tomorrow, then you have a little oozing because you're applying ointment, and there is some ooze comes from the wound area, which is very normal. So we'll be given this sheet, so which is has a white portion and a blue portion. The white portion, you can use it to cover your pillows because can be a staining in the process. So this white, you should touch your scalp. The blue can be in the back side. So this has got a water resistant one. You can use the sheet for the first 3 or 4 days till you use the ointment, not to stain the cloths. So I explained most of it. In general precautions, you can eat normal food. You can gently do walking in the basic exercises. We don't recommend extreme cardio exercise or any strenuous activities for first 10 days. First 4 days we recommend use only t-shirts because we don't want any friction while removing your t-shirt. T-shirt can be worn from day 5, and after day 5, once you finish your ointments, so once you finish your donor ointments, you can start using plain coconut oil. Coconut oil, you can use cold pressed or normal parachute oil. You can apply on the donor area comfortably, and recipient area. Even on the grafts, you can use the same coconut oil. Even because when you are using oil 2-3 hours prior to wash, the oil goes and soften the crustacean. So washing will be very simple. So we recommend oil in a good quantity, good proportion. At least 1-2 spoons of oil you can use liberally on the grafts and donor area. Donor area, it helps by improving moisturization, and it helps to reduce itching. So this completes your first 5 days of 6 days of care after transplant. So if you have any more questions, we are given your app actually. So through app you can share the pictures with us, and if you have any other unusual symptoms like a fever or any other pain, excess pain, you can always reach back to us. But most of the times it is very smooth and simple recovery. Just whenever you want to have any questions, I think I would answer most of questions in this video. You can look in this video. So one is donor area care, one is a recipient area care, and you can use cap from day 3 onwards, loose cap. Should not put too tight. For day 4, day 5, you can use a good cap. So if you really want to go out, day 3 is something we recommend. First 2 days we would recommend to stay back at home. You might see some swelling in the forehead, which is very normal. So we had given medication for that to resolve, which is very normal. So swelling naturally comes down. Some people, you may get a swelling under the eyes also, which is very normal. In a day or 2 it will also get settles. So nothing to worry. The swelling is a part of surgery because we injected a lot of solutions into the scalp, which because of gravity they come down, and because of that you see swelling, so which is absolutely normal. You can safely use the medication. This medication doesn't have any side effects, so they are only short course. Pain medication, for people who are really pain sensitive, the pain medication can be continued for a prolonged time, maybe 2 weeks, sometimes maybe even more. If you have itching, so we given some ointment. So it's a mild steroid based ointment. So this ointment we can use if you have an excess itching. So a lot of people complain excess itching in the donor area, which is very normal. If it is not subsided with the coconut oil, then you can use this ointment. It's a hydrocortisone ointment, which is called QT Soft. So this ointment you can use for the donor area, which is very safe. You can use on the beard also. You can use on this thing also. This completes the immediate post care of your hair transplantation. If you have more questions, anything, you can always reach back us in app or your counselor. So we are there to help you. Wish you happy recovery.